Okay guys, so the year is 2025 and I'm gonna talk about the trends that you are gonna see all over social media, some good and some bad, all in the beautiful world of facial plastic surgery. Let's dive in. In 2024, there was a massive uptake of people seeking out Ozempic, semaglutide, Mounjaro, tirzepatide for weight loss. And as a consequence of that, I previously discussed the volume restoration that people are seeking out to battle Ozempic face or facial wasting and aging as a consequence of rapid weight loss. That trend is continuing in 2025. People reach out to my office all the time for fat grafting and for filler to their face because they know that they need volume. Now, some of these people are actually also electing to get facelifts. Facelift is in the rise, guys. Facelift, 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 facelift. In the world of facial plastic surgery, facelift is king and the secret is out. Secret's out partly because my videos go viral and people are seeing all these amazing results. Facelifts can work for me. I'm in my 40s, I'm in my 50s. I thought facelifts were for old people. I thought facelifts made people look stretched and pulled. I didn't know facelifts didn't have really ugly scars. People are waking up. And so there's a rise, there's an increased trend for facelifts. And for me, that's amazing because it's my favorite surgery to perform. 2025, we talked about the rise of Ozempic face, facial restoration with volume loss. We've also talked about facelifts becoming the gold standard for facial rejuvenation. People are understanding now that fillers can't lift the face. Fillers can restore volume, but if you're really talking about lifting structure up, we have to lift it. We've got to go under the skin and reposition those tissues. So lifting procedures, brow lifting, face lifting, neck lifting, people are understanding now, people are becoming a little bit more educated that to really make the face look significantly younger, you have to take that laxity out. And a lot of those minimally invasive procedures are not getting the job done. So facelifts are on the rise. That's number 2. Number 3, people are understanding a little bit more about regenerative medicine. Now, what do I mean when I say that? What I'm talking about is making you closer to the way you used to be, rejuvenating you. Regenerative medicine is basically the study of anything that we can do to make the body restore itself. Anything from stem cell therapy, exosome treatments, antioxidants with bioproteins, with certain lifestyle modification. People are really taking an interest in their own health, whether that be hyperbaric oxygen, yoga retreats. People are doing all different types of things to look younger because I think the whole world understands that when you look good, you feel good, and you do good. Regenerative medicine, as it relates to facial plastic surgery, I've seen an increased use of exosomes. Exosomes are amazing. Basically, they're little vacuoles, right, that have regenerative proteins. And when we inject these things into the skin, they make our bodies heal ourselves, right? And so exosomes can be injected into the skin, into the hair, and with hair, you actually see hair regrowth. So exosomes, stem cells, all of these things that we rejuvenate ourselves with are on a rise, and people are actually starting to incorporate some of these things into skincare. People are taking basically their own cells, creating exosome, and putting that into skincare line. And it actually has a really good effect. So I think we're gonna see a lot more of that to come, but that's number 3. So number 4, everyone wants to know, how are all these celebrities and how are all these people just looking so rejuvenated naturally? Why don't they look like the old school plastic surgery where people look so weird and pulled and stretched? Well, plastic surgeons are getting better. Part of that is because our techniques are evolving. Some of that is because we're understanding the face a little bit better. Now, if you look at my patients, I've been doing this, but overall, you're seeing more viral videos of people looking rejuvenated. You may have seen some of mine. Why is this important? It's important because when we look at our beautiful celebrities that we idolize and we worship and we say, geez, these people have it all. They've got good looks, they've got money, they've got success, and they've got talent. why don't they look good, right? In the past, we're looking at celebrities and saying, these people with access to all this money, living in the best places in the world, they can't find a good plastic surgery to lift their face and make them look younger. Well, the cat is out of the bag. And now all of a sudden people are looking rejuvenated. That's causing people to step back and say, you know what? I think the best version of plastic surgery is one where people don't look weird or different. They look like rejuvenated versions of themselves. Now that's 100% my style. If you've seen any of my work, you will not find people who look weird or different. They will look like the best versions of themselves. And so that natural, almost unoperated look is definitely on the rise in 2025, and thank God. So let's talk about some of the trends that I absolutely despise. All right, let's dig in. As a plastic surgeon and as someone who really thinks about the face all the time, I've dedicated my life to this, I'm seeing some things online that give me a lot of pause. Now, being a plastic surgeon takes a long time. It takes a lot of dedication. And in the United States is a very set way of becoming a plastic surgeon, becoming a facial plastic surgeon. The standard is set very high, especially if you're board certified or double board certified in my situation. But the rise of plastic surgery and the interest has basically caused people to seek plastic surgery in other parts of the world. Now, there are great surgeons in all corners of the planet, but what I am finding is people are actually seeking out plastic surgery in places and in clinics with surgeons who might not have as much expertise, and they're actually getting botched. They're not looking good. I've actually had the experience where a lot of these clinics, actually, some of them, are actually stealing my before and afters, and they're posting it as their own. This is a problem. This is a huge problem because if you didn't know that that was my work and you see this before and after on their social media, you might think that you're gonna get a Dr. Truesdale facelift. Now, this is not ethical. It's definitely not supposed to happen, but it's really challenging as a doctor in the United States to fight this because what we're end up seeing is, one, we can't basically reach out to any body in these other countries and ask them to remove our things. Now, sometimes we can have our followers actually ask Instagram to take our content down, but sometimes they get away with it. It's unethical advertising, and it's basically luring patients in, and they're having these procedures done, and then they're not having great outcomes. So I've seen several patients, unfortunately, in the last year, and I'm sure this is gonna continue in 2025 and beyond, who've had other plastic surgery in other parts of the country or world, and they're not looking great. The techniques are not what they should be, and unfortunately, the patients don't have follow-up, and the standard that they have here in the United States is not the same. So unfortunately, that's a trend that I think is gonna increase. Because let's be honest, plastic surgery is expensive. And some of these other countries, plastic surgery is very, very easy to get into, even if you don't have a lot of money. But be careful, guys, especially in the world of facial plastic surgery, you only get one face, so take care of it. Another trend that I'm seeing in 2025 that I absolutely hate. I'm all about natural results, but I don't want people to look weird, okay? We've all seen it. This, maybe this. It is plastic surgery, and some of the surgeons might have a lot of skill, but the problem is people just don't look real. They don't look natural. They might look pretty good initially, but I can tell you as people basically come back and they're actually going through their healing process, that overly stretched appearance is leading to widened scars. Here's a photo of a patient who contacted my clinic about wide scars. Check out this. What's the solution? Go to someone who respects the tissues, who doesn't create too much tension on the skin, because things that look stretched or pulled do not heal well, guys. Things should look natural. They should look lifted, but not pulled. You shouldn't see tension. If you can see the fibers of the skin, it's not a good look, guys. It won't heal well. So hopefully this is a trend that dies in 2025 because I absolutely hate it. Another trend that I see, exaggerated and wild extreme plastic surgery. Now, the world is your oyster, and who am I to tell you what looks good and what doesn't look good? But I can tell you, I respect anatomy. And so when I see someone and they come to my office and they want a consultation, I'm going to give them something that a human could be born with, right? If you start changing the anatomy and making people have features that are not necessarily human, they're more elfish, or they're more stylized, I can tell you those things don't age well. They end up looking funny because as gravity sets on the face, the vectors or the pulls that happen, right, are not going to be respected. Imagine, for example, someone has an extreme cat eye, right? And then they continue to age. Well, what's gonna happen? As the eyebrow descends, this part is still fixated. It's gonna look funny, guys. We haven't seen it yet, but I can guarantee you in about 10 to 15 years, maybe 5 years, all these people who were on these Instagram pages looking super snatched and cat-eyed, they're gonna look crazy. People with these extreme facelifts, they're going to look crazy. So it's a trend that I don't want to see because I want people happy. And I want my specialty to actually make people's lives better. And I don't think it's going to age well. Okay, so we've talked about trends in 2025 that I like. We've also talked about some trends in 2025 that I absolutely hate. Hopefully this has helped you guys understand a little bit more about my perspective and giving you a little bit more insight into the beautiful world of facial plastic surgery. I'll see you soon.